For those who I have not had the pleasure to meet, my name is Matthew Rutler. I am the COCA president. And joining us on the call is also Dr. Kay Wagner, who is our president-elect for COCA. Hi, Dr. Kay.
Hey, everyone.
And we are also joined tonight by Dr. Rafi Lendovitz, who is an infectious disease doctor out of UCLA Medical Center. We're very fortunate that Dr. Rafi is on the call with us tonight. He is obviously on the front lines of all of this, but in addition to that, we have the added bonus that Dr. Rafi is actually a medical staff member at Camp Tecumseh in Vermont. So he is also very familiar with the camp world, not just the medical side. So he is a great resource that we have on the call tonight. So obviously questions can be posed to him. We definitely will refer to him for many of the questions that folks have, but we definitely need, want to make sure we hear from as many people as possible. So welcome everybody. So just briefly, what is our town hall? So the town hall, it's your town hall. While we do have a very loose agenda, it's a fluid agenda. So, depending on the questions that you have, the input that you are giving, that will really direct our conversation because it is all about your needs and your camp and your campers. What it's not, it's definitely not a lecture. This is really all hands on deck. The more you all are able to share with us, the better. And it's definitely not a time to be silent. If you have a question, please ask it, whether you ask directly or you use the chat function. Just make sure that you please, if you have a question, ask it. We'd appreciate that. On the next slide is basically the breakdown of how tonight is going to work. These are items that have already come to us, myself, Jen, Don, and Dr. Kay, in regards to the virus and its effects on our camps. So these are the main topics that folks are really questioning, and that's summer camp scheduling and operations, medical staffing and equipment changes, screening policies for campers, staff, visitors, and vendors, and then obviously other practices, current and moving forward. So jumping right in so that we can have a great conversation, we're going to just talk about the summer camp scheduling and operations. So prior to all of our town halls, we sent out a survey. And the survey asked the question, what current state and local restrictions are our camps facing? And these are the top items that we're all facing. And that is the max number of people at an event, school closures has a huge effect, obviously social distancing, and for many of us, it is also travel restrictions. Based on the survey, we asked, have you had to cancel events already, whether it be camp or other programming, in hospital, sibling programs, etc. And for the majority of our camps, April and May have shown a great deal of closing. June is starting to pick up, obviously based on our survey. June was not a high percentage, but this obviously was also sent out 2 weeks ago. And as we know, all the information is changing daily that we're receiving. So this number may obviously have gone up. We just didn't ask the question yet. So the first question we're going to put out there for folks to start to talk about and discuss is based on this camp scheduling and operation. So for those that are on the line, what are some of the factors to consider if you are holding or postponing or delaying your camp currently? So what are some of the factors that you all are working with now? And anyone obviously is more than welcome just to unmute and jump in. And again, I just ask that you introduce yourself when you speak, so this way we could just document who's talking.
Matt.
Yes.
This is Lynn Jones from Camp Happy Times. Can you hear me?
Yes,
Okay.
you're good.
I think one of our factors clearly is whether or not our staff will be available. So clearly, some of our staff probably is being impacted by job reductions, family situations, travel restrictions, et cetera. And so one of the factors I think we need to look at carefully is whether or not we will have the appropriate staff in order to operate camp.
Great point. This is Dr. K. I think that's on the front of minds for all of us. I know for us, certainly timing for our camp made a difference. We have an early June camp. We haven't officially canceled yet, but certainly things are leaning that way. I'm curious for other people, is the timing of your camp having any bearing on your decision on this point yet, or wait and see patterns out there, or where are other people so far with this decision?
So this is Susie Burke from Camp One Step. We have our sibling camp the middle of June, and we are pretty close to, we're leaning toward canceling the sibling camp or looking at potentially doing a weekend program or something later on in the year for them. We have been doing a lot of virtual for the programs we have had to cancel. We're doing a lot of virtual programming for kids because we had to cancel 2 programs in the spring as well. Our day camp for our younger kids, and then one of our family camp weekends. We're trying to make some decisions about our summer camp, which is July 11th through the 25th. We're trying to shoot for probably May 1st, just some decision making for that. But, you know, again, it's waiting to see what happens with the virus and, you know, how much risk are you willing to take? And from a staff and a camper perspective, and I think those are the things that we are trying to consider.
Hi, this is Yoram Unger. I'm a pediatric oncologist and the medical director for Camp Horizon in Baltimore. Thank you for letting me join into your discussion. And I'm wondering, has there been any discussion about a uniform or unified front in terms of whether, obviously knowing the epidemiology of this and the different states and different areas are going to have different infectious rates and the curve is different, but I think it would go a long way in assuring both the staff, the providers, and importantly the families' well-being if they knew that there was a unified kind of front. We're going to cancel, we're not going to cancel, knowing what the extenuating circumstances are.
Do you mean a unified front from COCA as a whole?
Either through COCA or just individual camps. I mean, it gives me great pause seeing what the virus's, you know, infectivity and things of that nature, and just having the number of kids and staff in close proximity, it needless to say, worries me.
Mhm.
Yeah, definitely agree. This is Dr. K again. I think that's partly what we're hoping to accomplish with with these town halls, is to really give people some overall feeling from everybody else. I noticed for me last night with the first meeting we had, it was great to hear that we're not the only ones that are struggling with a lot of these decisions. And I think the overwhelming feeling last night was what's already been brought up, which, you know, just is the concern and the fear about being able to have a safe camp that's still a camp. So I don't know if there's an official position yet with all the uncertainty about the virus and everything, but hopefully we'll get a little better perspective when we get everybody together to talk like this.
And this is Matt, and I can tell you as well, from the COCA board standpoint, we actually have our board meeting scheduled for tomorrow evening, and a large portion of our conversation will be in regards to the virus and its effects on camps. I'll actually be presenting to the board our findings from we're up to 11 town halls, so we'll be presenting that to the board and discussing it tomorrow as well.
Thank you.
Yes, absolutely. Thank you.
This is Dr. Mike
Dave
from Camp COCAI. I'm the medical director there. And I certainly share everybody's concern. It's hard to know exactly what's going to happen, and there will be variabilities from place to place in the intensity of the infection. And we can hope that as the weather warms and people spend more time outside, that this virus will disappear at least temporarily in the summer. But unless it's really gone, it seems to me that with the population that we deal with, it would be really hard to justify bringing all those people together, even if we tried to set up, screening and took everybody's temperature and examined them before we let them interact with anybody. Since this virus seems to be present in a significant number of people who have no symptoms, the risk would be high, I think, unless it really looks like it's disappeared for a while.
There was someone else that was going to step in, I think. Go ahead.
This is Brandon from Camp. I was just going to say that we serve kids in a much different way than many camps. We serve a variety of disabilities, medical conditions, et cetera, et cetera. Our board met via video conference last Friday and decided that our 2 medical sessions, which are the ones that our campers with cancer would typically attend, we are going ahead and canceling those and are waiting until May 1st to decide if we will have our other sessions for campers with developmental disabilities or autism, or adults with a variety of conditions. We would likely allow long-term survivors to attend one of the other sessions if we are going to hold them, but we're just in a wait and see pattern right now. And we'll make that decision May 1st. And then if the decision May 1st is we need to cancel the sessions in June, then we will meet again in June 1st to decide if we can have sessions in July and August. So that's what we're doing right now.
This is Bruce Hooper with Smile a Mile. Can y'all hear me?
Yes, Bruce.
Go ahead, Bruce.
I was on the call last night and was just struck by one of the comments. And clearly, I mean, there's so much uncertainty, and we've got a good number of our medical advisory folks from Smile a Mile on the call tonight. But the one comment that resonated so much with me, and I believe she was a nurse oncologist, who said, I would rather be sad that we didn't have camp this summer than sad that we did. And I have just been holding on to those words for the last 24 hours because it kind of leads me to where I think our medical advisory folks are headed, and probably to where most of us are headed. That, when you weigh the risk with the benefit, it's hard for me to wrap my head around us proceeding as normal.
Other thoughts, questions on the things that are on your mind as far as postponing or delaying your camps or canceling them altogether?
Yeah, this is Millie, Camp Happy Chums. I think a lot of our problem will be, whether we decide to do or not, is whether the camp that we will be using is going to be running this summer. They have a lot of overseas counselors, and I have a feeling that they're not going to be able to run their camp. So that right away stops us from having our camp, no matter what happens. And I would like to say that comment before about rather be sad than sorry is sort of my philosophy as well.
Thank you, Millie. I think that's point too that a lot of people are struggling with is they may not be in control of whether their campsite is available or not.
Exactly.
Millie, this is Ryan. This is Ryan from Happiness is Camping, and we rent our facility out as well, and we use a lot of international staff members. And tomorrow we're going to tell all this international staff members that they can't come. We've closed camp through June, and it's likely that we're going to close our entire rental facility for the entire year. And I'm sure a lot of camps are going to be in that same position.
This is Sherry from Kids Cancer Alliance. And I just, I know that our families, our campers all look to us for guidance, and we have to be the ones that make this decision. But has anybody reached out to their camper population to even ask how their families would feel about, would they send their campers? Because if you think about it, social distancing is something that they know very well from neutropenic precautions, etc. And I just wonder how many families would really feel comfortable sending their campers at this time.
Hi, Sherry. This is Barbie Ricken. I'm from Camp Rainbow in Missouri, and I'm a pediatric oncology nurse. And I actually was just talking to one of our longtime camper families at work last night whose child is admitted to the hospital right now. And we had this exact discussion. And she said, you know, as sad as my son would be if we didn't have camp this summer, I don't know if I would send him, even if we did, just because of the unknowns. And, you know, he's almost finished with treatment, but she's like, you know, the worst thing that could happen is he goes, has an awesome week and then home. And, you know, the worst could happen if he gets exposed. So I think there's going to be a lot of fears and anxieties with parents and campers, even if camp does happen, you know, the traditional way that it would have, sending their kids to camp.
I think in the people that this is Dr. K again, and the people that I've talked to, we've had some share that families have reached out with some concerns, exactly as you said about, you know, I know my kid loves camp, but I don't want to risk it. We also had the point brought up that a lot of parents maybe are ready for their kids to be somewhere other than cooped up at home. And so does that make them maybe more willing to send the kiddo? And then does that mean that we need to be the ones to make the best choice? Because it may be harder for parents to not want to deprive their kid of this wonderful camp experience that we all provide. I think that's come up in a couple of the different meetings that we've talked about as well. Just to be respectful of time, I think we're going to go on to our next topic. Remember that this does not have to end any of these conversations. Please keep talking in the chat room, and there'll be contact information at the end as well to keep on track. But some things that we had talked about, if you do want to think about having a camp or things to consider, one of the big things that came up would be, are there going to be changes to your screening policies for your campers, for your staff, and full-time volunteers? And what we mean by that are people that are going to be there all week. We did make a separate section for, say, day volunteers or people that come and go, but things that are on people's minds, things you're thinking about when it comes to your screening policies for camps. And maybe we could ask Dr. Rafey if he has specific things that he thinks we should keep in mind or wants to jump in here with some thoughts. Not to put you on the spot.
Hi, this is Rafey. Just want to first thank you all for inviting me to your town hall. And I realize we've got a lot of extremely sophisticated and seasoned medical professionals on the phone, so I think everyone should chime in. You know, from an infectious disease standpoint, my concern is that, you know, the emerging data is up to a third of people who are actively shedding the virus can be completely asymptomatic. And we know that the majority of people who are billed as asymptomatic are actually pre-symptomatic, and that within 48 to 72 hours of them being highly infectious, they're going to show symptoms. So I'm concerned that there isn't such a thing as an effective screening procedure that's going to render this a safe thing to do. And I think that's the biggest problem facing all camps in this upcoming season. And, I was, a lot of modeling has been done, and all models are dependent on what things you put into them, what comes out. You can make a model say anything. But with that in mind, the models do predict that really until we have a vaccine for this, any sort of congregation of populations is going to lead to a re-eruption, even if it appears to be petering out. Of course, we need to see what happens. That might be entirely wrong, but absent a vaccine that we can widely deploy, I'm fearful that we're going to be able to effectively screen and conduct a camp the way we're used to doing it this season. I'll be quiet because I'm sure a lot of people are going to have things to say about that.
Thank you for sharing that, Rafi, really.
This is Dr. Mike. I certainly agree with that. I think the only thing which might allow us to feel safe is if there is a test that's available to demonstrate immunity, and we are at this point a long way away from that. If we could only allow people into camp who had demonstrated immunity to the virus, then we might be okay. But other than that, I don't see any way to be safe the way this infection has been acting. I would agree entirely.
Hi, this is Stacy with Kids Cancer Alliance, and I'm one of the nurse practitioners there, and I agree with you, Dr. Mike. I think that we serve such a high-risk population that even having a sibling camp could put our patients at risk. And there's all this talk about flattening the curve, and whether it's true or not, they talk about things going back to normal and then possibly peaking again in the fall. So I'm not really sure here what the right answer is. I just know that it's a really scary time for all of us.
Hi, my name is Hamid Chamdawala. I am medical director of Camp Amerikids. I'm also a pediatric emergency medicine physician practicing in New York City. Thank you for having me on this call too. I have a question for Dr. Rafi. Regarding screening, how soon do you think some of these tests to check for immunity, or for that matter, a rapid test might come out into the market for a large scale availability for our patients, which might add as another tool that we can help for screening our patients? And what would be the sensitivities for these tests?
So I think it's a great question. So there is already a 15-minute test that's been FDA cleared and is available on the GenProbe system. So all sort of gene expert and GenProbe systems will be able to leverage that. The question is, analytic sensitivity in a laboratory is not clinical sensitivity. And, depending on the age group, how good a sample you're going to get may be variable, right? We know that a true nasopharyngeal swab, not a mid-nasal swab, much more sensitive than just sticking a Q-tip in the nose. We know a bronchial lavage is way more sensitive than a sputum or an NP swab. So I think a lot is going to depend on what kind of sample you're talking about. And the immunity question, I think, is a really important one. But there are some suggestions out of China that even people who develop antibody may lose immunity after some period of time. There are some documentations of people who were PCR positive, became PCR negative, and then recrudesced PCR positivity again. Whether or not that's a sampling error and people really never cleared, or if there actually is waning immunity on a very rapid time frame, is something we don't know the answer to, and could completely sort of torpedo that attractive idea of we know somebody's immune and only limit it to people who are immune in that way. So I don't know that in the time between now and summer programs, we're going to have a robust enough understanding of that to implement. So I'm concerned about that.
This is Dr. Unger from Camp Horizon in Baltimore. Thank you for elaborating on that. And I would add that in our oncology population that is either immunocompromised or not yet fully immune reconstituted, we have zero data that I'm aware of, and please correct me if I'm wrong, but I don't believe there's any data to speak to how this population in particular mounts an immune response, how long that takes, what does that look like, what the chance of reinfection is.
All of which absolutely true. And, you know, at Camp Tecumseh, when we were talking about some of our wintertime programs, that was exactly the conversation we had in the decision that was made by Dennis and Dina and the leadership of Camp Tecumseh at that time for exactly that reason. Completely agree.
I'm just looking at the chat. There's great conversation going on in the chat too, just about remembering that we also have to think about our volunteers that may be affected by being exposed, not just our patients and who they go back to, which is a wonderful point as well. Guys are putting a lot of great comments in the chat, so be sure to look at that if you can see it. If not, we'll be sure you get a copy of it along with the recording of all of this. So,
absolutely.
Other thoughts, comments on the screening policies or things to be considering in this question? If we go on to the next slide, just some things that have been brought up. You know, again, we're just throwing out there things to think about, things that might be coming up and to spark a little conversation. Some of this has come up already, but you know, things like how do you maintain social distancing at camp? As someone has pointed out, yes, our patients are used to the concept, but that's hard to do when you're getting to see your friends that you've been away from, and you know, things like if you're busing your kids or bringing kids to camp, how do you keep this appropriate space there? Does it have effect on your parent drop-off program? Or like for us, we have a parents program at the end of the week. So that'll be an interesting challenge if we try to have our camp. And I think has already been brought up, you know, how do you determine who's symptomatic? Because as I think has been pointed out, asymptomatic people are shedding the virus too. So is there anything else people are thinking about, or the things that are keeping you up at night? As I think someone called it on a previous town hall about this.
It's Chris Lehman from Camp Dose. There's so many question marks here. I can't imagine that we should consider taking our kids to camp. I'm sorry.
This is Yoram Ungar again. I mean, I think if anything, this virus has caused us to change our standards of care, and we're all recognizing that. And as painful as it is, and as difficult as it is to put emotions aside, I would hate to have camp where everybody has a great time, but one kid or one sib or one staff member got sick. I mean, it's just the risks here are tremendous, and the unknown is even more tremendous. And I just caution all of us as we think about that and what our responsibility is in order to continue to come back and have many more appropriate and safe and entertaining camps. And you know, I think that's pointing to the fact that we really need to think long and hard about, do we just sign this one season off and convert our efforts to the virtual arenas and the other things, which aren't nearly as fun. I get it, but it just I'm not hearing anything from the wise comments and chats that is telling me that somebody's thinking it would be a good idea to have camps. I mean, social distancing at camp with a bunch of kids, yeah, right. How's that going to happen?
Yeah, great point. And again, if you can see the chat, for those of you that are on the computer, and this, you know, a lot of those similar comments are coming across, that if social distancing is still necessary, it's not a safe time to have camp.
Out of curiosity, Bob Wilkinson. Sorry.
If everyone could just please mute their microphones, please. Go ahead, Bob, you were saying?
Yeah, we've been talking about controlling our staff and our children. That like our camp, we have a lot of ancillary staff that belong to the camp itself. And they come and they go, and then they go out in the general population. And they come back in like in the morning to feed the kids. That's going to be a point of hard control. How do you monitor them? How do you assess them? Because they're all going to have some contact, feeding, maintaining around your camp.
That's a great point, and actually a perfect segue into our next slide too, which is, if you've got visitors or if you've got people that are just coming for the day, what do you need to think about for them in screening or taking temperatures or those types of things. So again, a whole nother piece to consider that may be out of your control, especially if you have a rental facility where you are not in charge of all the staff that are there.
Oh, fucking thing.
Other people that are dealing with stuff like this, or again, the keeping you up at night questions with this?
This is Dr. Mike again. I guess I still would return to the same point. If we need visitor restrictions, we probably shouldn't be having camp because there's just no safety between the people who come in.
Amen.
And I can just, this is Matt, I would just also just throw this out, that this virus, this, total overwhelming sadness and everything that everyone's feeling, there is a benefit, an unfortunate benefit to all of this, and that is that we have a great opportunity to truly strengthen our camps by really looking at how we function, both on the medical side as well as the programmatic operational side. So yes, while it is extremely frustrating and extremely sad at the potential of, changing camp, and I say changing camp as opposed to canceling, changing camp. We definitely have a benefit of how we look at how we do things. This is giving us a great opportunity to really look at how we function.
Well said.
Hi, this is, sorry.
This is Dennis with Camp Tecumseh. I just want to echo what you just said. And as we all come to grips with the reality of probably canceling our programs or needing to cancel our programs, I do hope there'll be town halls to talk about how we create the magic in other ways than being together. Because I think that sharing of ideas of how we create the magic in ways other than being together will be really important. And, thoughts on, we heard in the other town hall about people using gloves and masks when they're packaging up things to send to the kids. And are those kinds of things necessary as we look to do alternative programming? I think all of that we're going to need, once we get over this hump, to start talking about those things and figure out how do we do that and what does that look like?
Absolutely. And to answer that question, Dennis, it's very easy for me to say yes. These are the first town halls that COCA, as far as back as I can remember, these are the first ones we've ever done. And already we see such a great, we've had great feedback, and there's such a great need for it. So yes, we already are in the talks of doing additional medical town halls, specifically towards the end of this month, when obviously things, continue to change and develop. But yes, we were also in talks with a few folks to set up how to go virtual and things, thinking about camp in a box and that kind of stuff. So yeah, that's definitely something that will happen. But just something, I'm sorry, go ahead.
I was going to say, I think something that actually Matt mentioned last night, you know, maybe this will also be an opportunity, and it's been brought up in the chat too, for us to review a lot of our policies, whether it's about communicable diseases or what, and just what does camp look like in the scenario of infections and things that we have to make sure we're being responsible for. The next slide talks a little bit about medical personnel, supplies, equipment, just some things we brought up. And I know it's been mentioned, you know, PPE is not an easy thing to get right now. So obviously that would be a consideration too, and maybe that's a consideration for going forward. But sorry, Matt, I didn't mean to interrupt.
No, you're fine. That's where I was going with it. Because that's on the next slide. Just another obviously thing to talk about is exactly what Dr. K said. The additional equipment, the possible need for additional staff, for screening, etc. Just other things to think about as we proceed. I'll put this out there to everyone in the group. Are there any topics or anything any questions that anyone has of each other? That might be an opportunity. This might be an opportunity to bring up some things that may not have been addressed, that y'all are thinking about or would like some feedback on from other members of our community.
I have a question. This is Dave. First, Dave Caterino from Camp Tecumseh. Hey, you guys keep referring to last night's meeting. Who was at last night's meeting? And other than the great quote that we got from the nurse, what else was the highlights of that meeting?
Dave, this is Matt. Again, there were obviously many medical professionals from our camps that were on the call, as well as a pediatric infectious doctor from South Dakota. He joined our call. Honestly, the conversation that we're having now is almost identical to the conference call that we had last night.
That's fine.
We just really set up 2 times just to make it convenient for folks, but in reality, the conversation has been pretty much the same.
Thank you.
Hi, it's Michelle Vernon from Sunrise Association. I was on last night's call and tonight's call as well, and I have a question to you guys just as COCA, and I'll go back to Dr. Ungaru's initial question. Based on everything that you're hearing, that we're all hearing at both town halls, is COCA, and I know, Matt, you're going to the board tomorrow with a conversation about these talks. Is COCA going to consider at any point in time making recommendations? We as COCA accredit camps. So is COCA going to consider making any recommendations to the camping community, its camping membership, as to how to behave this year, certainly with the COVID-19 illness?
And that's honestly, that is really the purpose of, or I shouldn't say it was the original purpose of our board meeting being tomorrow, but that is really and truthfully what we need to discuss. Yes, we are all feeling the exact same way. We're all camp people, and we're all in the same boat and kind of all leaning in the same direction. But to come out with an official standpoint, that's something, yes, that the board is going to address tomorrow as a group. And then obviously, yeah, we would, anything we put out will be sent to everyone, whether it's an official stance or recommendations. A lot of what we say now is obviously follow, and then somebody said it on a town hall much earlier, not a medical town hall, but obviously you follow the CDC guidelines, and then you have your state and local guidelines, and obviously which one is the one that's more strict is the one you follow. And I always lean towards anything the CDC says. That's where I'm going with. But yes, to answer your question, Michelle, the board and we will be discussing it heavily tomorrow, and then presenting something to the membership.
Hey Matt, this is Kelly Reese with Smile 'em Out.
Yeah.
Just one quick thing that was brought up last night that I don't know if anybody's covered tonight. I don't think I've heard it, but just from the liability standpoint, not take away all the medical stuff. The liability too is also an issue. If there are certain recommendations in place or certain things, and then you as a camp decide to move forward, what does that look like on your for your insurance and liability if you with so many unknowns about this virus? I just wanted to bring that point up.
Thank you for bringing that up, Kelly. Yes. And that's something that a few camps are now looking into, not just, for this year, but for any year, is to really look at your insurance policy when it comes to infectious diseases and the possibility of it occurring at camp. So yeah, I would highly encourage all folks to address touch base with your insurance companies. We've, as a COCA organization, we have reached out to, or we are in the process, of reaching out to Markel about doing a town hall in regards to insurance, and specifically, with infectious diseases and that kind of stuff. So, obviously stay tuned for that. That's going to be coming up.
Okay.
Matt, this is Faith.
Yes, Faith.
In regards to insurance, remember, not only would it be a problem with your insurance coverage, but if you did have a child that got sick or an adult during camp and it got to the newspaper or whatever, you would be tried there. So it's more than just the monetary, and certainly could ruin your camp.
Right.
Hey Matt, this is Deb from Camp I Hope. And as Brandon pointed out in the chat, and others on the call, how the American Camp Nursing Association had talked about this is going to be with us for the long term. Is there a possibility that under the direction of COCA, we could leverage some of the expertise amongst our camps and come up with a kind of universal communicable disease policy and how we address COVID-19 going forward past this season, versus everyone trying to develop their own separate, kind of have a template. I know there's differences in general between camps, but at least having kind of a baseline where we harness the expertise amongst our organization so that it benefits all of us.
And I can also answer that with a yes as well. I do like when I can tell people yes. But yes, we are currently, Dr. K and I actually have already spoken about setting up a group along with Mary Ellen McKnight, who is our research and education chair for COCA. She's our go-to for our CEUs, et cetera, for the conference. So we've been in contact to talk about setting up a group of medical professionals to create such, as you're talking about, some templates for folks to use, and then also other ideas and things that around communicable diseases and infectious diseases, to give to everybody. So yes, that is also in the works.
Thank you.
Yes.
This
And
may be
go ahead.
This may potentially be some topics for the CEU track at the meeting in November too, which we haven't really finalized obviously yet, but certainly there's a wealth of discussion around all of these topics. So I'm sure it'll come up there as well.
So Matt, this is Ryan from Happiness is Camping. I just wanted to add that we've from a rental perspective, we've had a lot of camps that aren't specifically serving special needs populations. They don't really know how to clean their camps to make them totally sanitized and safe for a special needs population. So they don't really know how to react to this COVID. And we tried to get a lot of our cleaning supplies as well as toilet paper. And we use the largest supplier of camps in the entire Northeast. And we were severely limited in what we could order. It wouldn't even be enough to get us through basically the first month of May before our kids even got here. So that's going to be a big problem in the camping industry as a whole this summer as well.
That's a great point, Ryan. And I was talking with my medical coordinator last night as well, and she said the same thing as far as, you know, possible equipment or other items that we would typically have on hand for camp. It may be a difficult to get those. So yeah, so absolutely. Are there any other questions of folks that are on the call, or any other concerns? You know, I'm so thankful that we have this opportunity together. So I just want to make sure if anyone has any other questions or comments or concerns, we definitely have time to hear them.
Matt, Terry from Camp Dose, Pennsylvania. You know, from what I've been hearing thus far, and I've been on many webinars about COVID-19 over the past couple weeks, and I'm happy to be in a forum right now with a lot of medical professionals. But a lot of what I'm hearing is through all these seminars and webinars is a lot of unknown information. And in addition to making sure our campers have the most fun experience possible, whether your camp's a weekend or a week long, our main priority is the health and wellness of our campers. And because of all the unknowns, and without vaccines that are proven or treatments that are proven in good conscience, as an administrative committee member, it would be difficult for me, as sad as it is to say, to allow kids to come to camp at this point.
Jen or Don, would one of you advance the slides to the contact information just so that people have our... There's also the Facebook page. I've seen some questions about the Facebook page on the chat. So remember that COCA has a Facebook page and a listserv you can go to for information or for other questions you want to discuss as well.
Right, and COCA will also be setting up, as Don posted, we will be working on a Slack page. So we'll get that information out to folks as well, coming up soon. And there are a lot, you know, for folks who are interested, there are a lot of, you know, those Slack groups out. There's also another group on Facebook, the Summer Camp Professionals. You know, it's a great resource, especially if you all are looking to go virtual. You know, I've been on that group now for last few weeks. It has great information. They're not very, the group itself is not very specific to oncology, but it does have some great ideas that y'all might find useful.
So dead.
So before we wrap up, I just want to, you know, just take another second to see if there's any other comments or questions from the group.
Yeah, I'd just like to say this is Chris Lehman from Camp Dose.
Yes.
There really is a very different tone from the town meeting tonight as there was last night. Let me just make that point. And I'm glad to see it. Thank you.
Thank you. There was a question on the side about if the board does have recommendations, when should we expect to receive them? Honestly, as soon as possible. It's I know that's a vague answer, but honestly, we want to make sure that our message is very clear, and we have as much information as we can. So to answer that question, and I apologize if it is vague, but we would. People are laughing at me. I can hear them. As soon as possible. Ideally, we'd love to be able to, give something out by Friday. But we do want to make sure that everything is in order. After this call, if folks would be so kind, we do have a survey, and I do see a question on there that I will get to. We do have a survey. If folks would be so kind as to, the link will be on the screen, but also there is on our website, the COCA-I website, is just a quick 5-minute survey in regards to this town hall and future town halls, recommendations, comments, concerns. So please, if you have an opportunity, we'd love to hear from you. That'll also help us in our discussion tomorrow and obviously moving forward. There was a question put out there that their camp is the last week in July, first week of August. And does anybody have any thoughts if we should possibly cancel?
This is Dr. Mike at Okaizu, and none of us know exactly what's going to happen. What we are trying to do is to hold off and just see how things develop, and hope that the virus will disappear entirely for a period of time during the summer. But I think realistically, it's very unlikely that that is going to occur. Some people have raised the point that it might be kinder to people to cancel sooner rather than later, so they're not hanging out until the last minute. I'm not sure what the right answer to that question is. My feeling is that it's unlikely that any of us are going to be able to do our summer programs, but I'm still not quite ready to make that a definitive finding. And so we're going to hold off at least until the beginning of May before we decide about our summer season. But I don't think there's a right answer to that question. But I do think that the likelihood is high that we're going to end up not having very many summer camp sessions this year.
It's Michelle from Sunrise Association. I think one of the pieces that we grapple with is being able to have our children have their medical forms completed. And given the stress on the medical profession right now during this outbreak, and the closure of medical offices only to those people who are in critical need right now, in many cases, raises a question as to whether or not our staff and our campers will be able to obtain their medical forms, and we have the time to review it well enough in advance of them coming to camp, so we are prepared to receive our campers and staff well.
Very good point, Michelle. Two other comments on the chat that I just want to bring to folks' attention. And Avril, I'm going to ask a favor of you. So Camp Ooch and Camp Trillium Medical Advisory Committee just published a document in the Pediatric Blood and Cancer in regards to infectious screening and activity considerations. So Avril, I saw that you posted it. I was wondering if possible, if you could forward me the link to that document. I would greatly appreciate it, and I'd love to be able to share it with everybody. Love to hear what you all have to say. And then also and folks, you are going to get a copy of the chat box as well. So, you'll be on the lookout for that soon. But Dr. Rafi also said, obviously a huge wealth of expertise in this group. He's also offering, if anyone has any questions or needs help, to email him. He put his email address in the chat. Those who are on the call, again, you'll get a copy of this chat. So his email address will be on that. Or you can reach him through Dennis at Camp Tecumseh. So, thank you, Rafi, very, very much for that. So we're definitely seeing some great things on the chat with in terms of collaboration on virtual programming. So definitely be on the lookout for, regardless of how camps go, this may become a great addition to folks' programming, this virtual aspect. So please be on the lookout through COCA and through other avenues of ways to engage in virtual camping. But, you know, on behalf of Dr. K and myself, I want to be respectful of your time. And I know for those of us on the East Coast, it is much later. But just thank you all so very much. I don't
Thank
think.
you.
Oh, no worries. I say this on behalf of, you know, while I have learned tremendous amounts of medical knowledge being involved in the camps that I've been involved in, it never ceases to amaze me the wonderful wealth of just heart and expertise that our COCA camps have in terms of our medical staff. And I'm not really sure if we say it enough, but thank you all so much for all you do for our campers inside the hospitals, outside the hospitals, at camp, outside of camp. Let's be honest, you know, how many medical professionals, and I'm not knocking medical professionals, want to give up an extra hour of their time just to be on a call to talk about something like this? So thank you all so very, very much for being here tonight. Please let the conversation continue. Email us. Our contact information was out there. Once you get all of this, the recording and the chat box, you know, reach out to those folks that were on the call. And thank you so much. Please, please be safe. Take care of the ones you love. And we will be in touch soon.